Hello everyone, my name is Giovanna and I will be presenting on dental care in nursing homes. So I want to start off with a little story. So JM is a current resident at a California nursing home facility. In 2020, he had a stroke which left him with a brain injury and difficulties performing daily tasks such as brushing and flossing his teeth. In the 9 months that he has been in the facility, he has not seen a dentist or a hygienist, even though a dental consult was ordered for him upon admission into the facility, and he only gets help from nurses with brushing his teeth if he asks. And in the 9 months that he has been there, he has never had his teeth flossed. JM is an example of one of the 1.3 million out of 1.4 million people living in nursing homes that face barriers to oral health. So for my research, I sent out a 9-question survey to a nursing home support group that I found on social media. 32 people who live throughout the United States responded. Participants mostly were people who had a family member or a friend who currently lived in a nursing home facility, but I also received some responses from current residents themselves and people who worked or were retired from facilities. So I wanted to find out a little bit more about the residents. So 56.3% had been living in a facility for 0 to 2 years, and 75% of them were on state insurance or Medicaid or Medicare. So I briefly want to describe the differences in Medicare versus Medicaid. So Medicare is federally funded. Part A and Part B both do not cover dental. However, if there is an emergency dental situation that is treated in a hospital, that would be covered under Part A. People can also pay into Medicare Advantage plans, which have some dental coverage. However, there are limited providers. Medicaid, on the other hand, is state and federally funded, so dental coverage varies by state, but again, there are limited providers. To put it into perspective, in 2016, there were about 39 million California long-term care residents and only about 27,400 participating general practice dentists. That puts the ratio at about 1 dentist per every 1,400 residents. I then wanted to ask some specific questions on dental care within the facilities. So I first asked, how often did you or your friend or relative go to the dentist or have their teeth cleaned by a dental hygienist? Over 50% said never. I then asked, if unable to brush their own teeth, would the nurses come help with daily brushing? Majority said no, followed by 34.4% who said yes, but not every day. Do the nurses help with flossing? 89.7% said no, never. Dental care is a top priority in nursing homes. 62.5% strongly disagreed, and nobody agreed. The last question I asked, do you believe that your friend or family member's dental needs have been met? An overwhelming 100% of the 32 participants said no. Despite all the state and federal challenges with dental care, nursing homes have their own policies and procedures that they are required to follow to receive funding. Federally, the facility must provide Medicaid recipients with emergency services and routine services to the extent the state Medicaid plan covers them, at no charge to the resident. Each state is different, but in California, there are specific requirements they must follow. For one, they must perform an EO-IO exam within the first month of admission, unless it was done less than 6 months ago and was documented, and they must re-examine every patient every year. Oral hygiene instruction must also be given to staff and clients, and facilities must provide or obtain an outside source for emergencies, but they may charge the resident. Facilities must also promptly refer to a dentist if dentures are damaged or lost, and they must assist residents in making appointments and helping with transportation to any dental appointment. We all know that oral hygiene is correlated to overall health and is linked to certain diseases, but did you know that 1 in 10 cases of death from pneumonia in elderly long-term care residents could have been prevented by improving oral hygiene? Did you know that many residents are in pain or undernourished due to lack of dental care? Despite all these shocking results, nursing homes do face some barriers that should be mentioned. Number one is resistance. Some residents just do not want help or assistance. One nurse specifically said that some patients will bite on the toothbrush, which makes it challenging for her. A second barrier is time. Many facilities are understaffed, which leads to time constraints. One nurse responded saying, "Honestly, I try my best, but I have 20 residents to put to bed and only one of me." The third barrier is finances. As we discussed earlier, Medicaid and Medicare dental funds are extremely limited. These are some testimonials that I got from the survey. At the end, I did have a comment section. There were a lot that people put, and these are just some of the highlights, so if you'd like to pause and read some of them, you are more than welcome to. So what can we do? We can advocate. We can become better advocates for oral hygiene instructions to nurses, or we can become RDHAPs. That way we can get certified and we can get in there and perform dental services for this community. And a lot of people were grateful and thankful that I was researching into this since it is such a prominent issue, but one woman made one statement that I want to end on. She said, "You can be the next generation to change how our dental care can improve. Bad teeth can cause lots of medical problems. I have personally seen toothbrushes never touch a resident mouth. Be the change." These are my references. Thank you for watching.